Hey everybody, welcome back to the channel. Today we're going to be talking about heart disease 101. So what is heart disease? What are the causes? The natural remedies behind this, things that you can do to prevent it, and then also supplement recommendations that if you were a patient of mine or if you were in my family, what I would recommend. Now, the reason I'm making this video is that my father just had a heart attack, and so with knowing about heart disease and it being the leading cause of death in America, I think it's very important to get this education out there. And we're going to be talking about some case studies, one my father, two my uncle, and just how they are different, but they ended up with the same disease. And so when it comes to heart disease, there are many things that fall into that category that maybe people don't understand. So there's coronary artery disease. This is where the plaque actually builds up in the arteries and causes lack of blood flow to the heart. And this a lot of the times is associated with cholesterol, but I'm going to be talking about why the new studies are showing that that may be more of a myth than a reality. The next one is arrhythmias. This is just an irregular beat in the heart. A lot of the times if you think about wiring in an electronic device, if there is any issues with the electrical system, then you'll get an aberrant output. And so that's technically kind of what an arrhythmia is that there is a problem with the wiring in the heart. And then heart infections, there are certain bacteria that can lead to these heart infections. Streptococcus is kind of one of the main ones. And that can sometimes come from the mouth, especially if you have like strep throat. You have to be very careful about that getting to the heart and causing issues. So now there are other issues that go along with this, but these are the main three that I think are most important when it comes to this. If you have any feedback or if you have any questions, please leave them in the comments below. But when it comes to causes, now we're going to mainly focus on coronary artery disease, because that is one, what my father and my uncle has, and what I think the majority of people have when it comes to heart issues or heart disease. And smoking is one of the biggest issues. Now, my father is a smoker. While I've tried to get him to quit, it is very hard to. But when we treat people for neuropathy here in the office, that is a non-negotiable for us. They have to stop smoking because it damages the microvasculature, typically in the hands and the feet, and it causes neuropathy or the nerve disease. So it's more of a vascular issue than it is an actual nerve issue. But this will also damage the smaller vessels around the heart, and it will cause the vessels to become hardened. And that can lead to that plaquing. It can accelerate the plaquing, which is going to choke off the blood flow to the heart. The next thing is high blood pressure. And we see so many people on blood pressure medications. One thing that I think is very important to understand is essential versus non-essential hypertension. Essential is as you age, the elasticity of your blood vessels gets less and less. And so what happens is you need higher blood pressure in order to still get perfusion out into the muscle tissue, into the brain. If you don't have that, then what will happen is you'll become fatigued, you'll become tired, and that can lead to many other issues that we see with like chronic fatigue syndrome if you're pushing the blood pressure too low. But a lot of the times if it's going especially above that 150 is when we really start to get cause for concern, because that can cause too much internal pressure and it can really cause damage to the arteries, the veins, and to the heart. So high blood pressure is a cause for concern, and you really want to talk to your heart doctor about why that can be going on. That it can be a whole video in of itself when it comes to blood pressure and why you might be having those issues, but I'll make a video more about that. But high blood pressure is a cause. And then increased cholesterol. Now, why I said earlier that this may be more of a myth than a fact is because if we think about if you go home today and all of your stuff is gone out of your house and the police are there, did the police rob you? And so you're probably thinking, no, they didn't, or maybe they did. But most likely they didn't. They're just there at the scene of the crime when the crime happened or when the robbery happened. And now, while they may be there, that doesn't mean that they're the root cause of it. A lot of the times what cholesterol is doing, as you get inflammation in the vessels, cholesterol acts as a putty, and it comes and it calms that inflammation down in the vessels. And it's trying to repair any of the damage to the vessels, but as a consequence of that, what happens is that cholesterol builds up in the vessels where it eventually causes lack of blood flow to the heart or to the other organs. And so while cholesterol gets a bad rap, it's not always the culprit, or it's not always the root cause of why that plaquing is occurring. What studies are showing more now is that sugar causing inflammation in the vessels is the root cause of why people are getting these plaques in the arteries, causing these coronary artery diseases. So if you have questions about that, comment below. I'd love to talk a little bit more about that with whoever wants to chat about that. And then the next cause is obesity. So being overweight, obviously that comes from increased caloric intake. Most of the time that is from eating high sugary foods, which goes back to this cholesterol component, which causes more damage to the vessels. And then you have to have more cholesterol in order to prevent the inflammation and to prevent any of the damage that is occurring in the blood vessels. And then physical inactivity. Now, your heart is a muscle, and while it's not like your skeletal muscle, it is cardiac muscle, it still needs a certain amount of activity in order to maintain healthy. And I'm gonna kind of jump over here to the natural remedies. This is where the exercise comes in so critical to having good heart health. And what they recommend is that you do 150 minutes. So if you divide that by 7, then what you're looking at is you're looking at a very small amount of exercise that you would have to do every day. So it's really not that much, and that's at a moderate intensity. So that's probably keeping your heart rate, below that 130 to 140 with the moderate. Now, if you're doing vigorous activity, and it depends on what you calculate your heart rate max to be, depending on age, that's typically over that 130 to 140. You're really pushing it, but they recommend half of that. So you could actually, if you're very busy, if you're very active, if you've got a lot going on, then you could just do 75 minutes of vigorous activity to get that same benefit. Now, what I recommend most of the time is Tabata. 10 minutes, if you do 10 minutes, 7 days a week, or 12 minutes of Tabata, you can get that done. And Tabata is just where you exercise for a short amount of time, let's say 20 seconds, and you rest 40 seconds. And you can do this with body weight exercises. You don't need a gym. I like it the best, and that's what I use when I'm really busy or I can't get to the gym. Tabata is great. If you have questions about that, comment below. So now moving over to the natural remedies, the honest review is that diet can fix about 80% of all chronic conditions out there. Now, with neuropathy, I hate to make kind of the plug in here, but with neuropathy, now that is not the truth. A lot of the times neuropathy, the damage is too far gone that you have to do some sort of reparative therapies for that. But as far as the heart goes, and making sure that these issues, these coronary artery diseases, don't get any worse, then diet is a huge component to that. And you want it to be high in omega-3 fatty acids, which is largely found in fish. So making your fish a main constituent of your diet is a great idea. And going more towards like a Mediterranean style diet is kind of the gold standard when it comes to heart health. And decreasing sugar. Now I only put 2 on here because if you do both of these, you're doing 80% of the work that you need to. So increase your omega-3 fatty acids and just decrease your sugars, okay? If you don't know how much sugar you're consuming, I guarantee you're consuming more than you think. Measure it out for 1 week. Don't be lazy with it. See how many grams of sugar you're actually consuming a week. Comment that below, and we can kind of break that down if that's way too much, way too little. Well, it's probably not way too little, but if it's way too much. So we've already covered exercise. Now, stress management. This with my dad and smoking is what I think really caused, and obviously diet, is really what caused him to have that incident. and he watches Fox News, his blood pressure goes up every time he watches it. He gets stressed out about what's going on in the world, and there are just some things that you can't control. So my advice is get away from any of the media that is causing your blood pressure. Take it, see if it is raising your blood pressure. If it's not, you're fine, but if it's raising your blood pressure and your heart rate, you know that it's a stressor. But stress management is key when it comes to controlling the amount of damage that occurs to the heart and the amount of artery disease that you end up developing. Now, ways that you can do stress management are journaling. So get that stuff off your chest, get it out of you, because if you let that stuff build up, it's going to be like a tea kettle and one day it's going to explode, okay? So journaling, meditation, take 5 to 10 minutes, just do some real light breathing, kind of get back in that state where your heart rate's calmed down, your blood pressure's calmed down. That is a huge benefit when it comes to stress reduction. The last thing is kind of what I talked about. Decrease the amount of tech that you're using and the amount that you're on social media, especially if it's something that the world is just going crazy and it's going to hell. That is something that is really affecting you, even though you don't realize it, at a biological level, at a physical level, okay? Now, supplements. Now, here is the main supplements that I recommend. Now, you don't have to use all of these, you can just use some of these, but when it comes to this, omega-3 fatty acids, especially if you're not ingesting enough fish, is great. CoQ10s, they typically recommend that if you're on a statin most of the time, because that will help with the heart health. Green tea, so if you're from the South, like my father, switch out your sweet tea for green tea because it has a bunch of polyphenols and antioxidants in it that can help reduce the inflammation in the arteries. Garlic is another great one. It's really antimicrobial, antiviral. It has a lot of really great components to it. Typically, if you have like a common cold, if you have strep throat, garlic is a really good natural remedy. Vitamin D and K2. Now this one is the most important one. So with this can actually take that K2, can take that plaquing and actually move it out, okay? Now that is what they are saying and what studies are showing, but the K2 is very important for calcium placement. And that's why if you really want to go get a good test about how your heart health is, get a calcium test. That'll tell you more than any other test. It'll tell you about how much calcium buildup is actually in the arteries. So K2 can actually help the displacement of that calcium, put it into your bones rather than it just building up in your arteries. So very, very important here. Hawthorn berry is a newer one that I didn't really know about, but apparently it can help with heart health and decreasing inflammation. Same thing with turmeric. Magnesium will help with the vessel constriction and dilation, so that is always a great one. And then red yeast rice, just a lot of anti-inflammatory properties. So with this, we know that we want to decrease inflammation 100% with a lot of these. We want to do fatty acids to support heart health, and we really want to reduce the amount of inflammation in the vessels as much as we can while using the vitamin D and K2 to try to displace any of that calcium that gets built up in there. So now the case study with my dad was that he was a smoker and then his diet was off and he was really stressed out. So these are the things that I could see just from the outside that really caused this event to happen. Now, with my uncle, he's not a smoker, has a pretty good diet. There are a few things, but he has a genetic disorder where he actually makes too much cholesterol, and his cholesterol runs extremely high. It's almost sometimes in the 600 to 800s. And so now he does have to take a medication in order to help manage that. But there are other things that we have done in his diet that have greatly helped reduce that. So there are always things that you can do. So thank you all for watching this. Hopefully share this with your family, friends, or loved ones so that they can understand what's going on and just some simple things that they can do in order to have great heart health, okay? So now there's some free resources in the description below. If you have any questions, please comment, and I will see you all next time. Bye.